Dr. Usman, welcome back to the M42 main stage. Now, I began by saying that you've all taken time out of your very busy day jobs to join us here today. These types of conferences, we've been on stage with M42 at Arab Health. Here we are at Abu Dhabi Global Health Week. They're powerful places to connect with colleagues, to explore fascinating, profound issues like this. Your perspective.
Absolutely. Assalamu alaikum, good afternoon, good evening, everyone. It's a pleasure to be here. I think being here and having all these smart people around us is a testament to why we do what we do. We're all here technically thinking about how to improve human lives, disease conditions, and really how to work together in a more innovative fashion to decrease the burden of disease all over the world. And that's really the essence of why we're all here. And I think this is very exciting. And thank you all for being here to join these conversations.
Fantastic. It's really good to get your perspective. Now, when you speak about improving human life, this particular focus area that we're discussing here today, enhancing international patient outcomes when it comes to transplant surgery. Let's just set the scene. What are some of the challenges that we are facing before we talk about some of the solutions?
So, listen, this is an issue that hits home, and probably all of us can relate to this at some level with our families, friends. 90% of the people in this country are expats, and we have families in other parts of the world who've faced healthcare challenges, some of which might have been able to be addressed in our home countries and others not. We're in a very unique situation where we are in an environment, in a healthcare setup, and in an international setup where we have access to some of the cutting-edge technologies, medications, facilities, and more importantly, expertise in people where we can take care of some of the worst diseases in the world, things that shorten someone's lives to the next few weeks or a few months. Now, the issue with that is that if you are thousands of miles away from a hospital that can provide you with the care that you need to live beyond a few weeks, for 90% of the people around the world, and we're talking about, I guess, 5.25 billion people, access to that healthcare is not possible. It is just not available. It is too far. It is too costly. Your physicians have never heard about it. There's not enough knowledge about it. So the challenges are obvious. On top of that, when someone is really sick, your family's suffering, your whole social environment is suffering, leaving your home to travel thousands of miles to go meet a bunch of strangers who you've never met, who don't speak your language, and trusting them to take care of you is a very profound and dark feeling and place to be. But it is our privilege that out of that darkness comes hope. That ultimately we find people in different parts of the world who can help, who can hold your hand, pull you out of that darkness, and take care of you. And this is what I'll say is special about everyone here, that our promise is that we take care of you like family. Whether we take care of you here or we help you get to where you need to get get the care that you need, we're getting pretty good at that. And we're very thankful to the country, to its leadership, to allow us to function in that fashion, where we can take some of the world's best healthcare, bring it to the center of the world geographically, where the vast majority of the world's population can travel to and has access to. So it truly has been a game changer being here in the last 10, 15, 20 years that Abu Dhabi, with the vision of its leaders, by building the healthcare setup that we have now in this country, can take care of some of the world's sickest patients who now don't have to travel a long distance, who can now go to a country where they have some assurance that people will take care of you like they take care of their family members. And that is really what this is all about. We're whether we're surgeons or physicians, or we work in AI in healthcare, or we work in genomics, or we work in maternal and fetal care, this is what we're here for, and this is what we're talking about.
And you put it in a very powerful way and poetic as well. Out of darkness comes hope. Really appreciate you outlining this. I'm going to jump around a little bit, if I may. Dr. Waleed, if I can bring you in. You are Department Chair of Urology in the Surgical Subspecialties in the Institute at Cleveland Clinic Abu Dhabi. Later, for our grand finale, you and I are going to be on stage talking about a very particular new development. So we're just going to tease the audience about that. Stick around for that. Before we delve into that, this particular area is seeing great innovation, transplant surgery. To build on what Dr. Usman is saying there, it's quite unique to what the UAE is offering the world.
Is in the sense that our goals are really, as Usman said, to be able to deliver this level of complex care to a part of the world that traditionally has had challenges receiving it. And if you look at a map, we are about 4 hours away from 2/3 of the world's population.
Dr. Waleed, just bring the mic all the way.
2/3 of the world's population live within about 4 hours from us. And so we are in a unique position to be able to change a lot of lives in a way that wasn't possible for us. And the unique aspect about being here is, as you can see, how much change happens year by year by year in this country, which is change and innovation is in the DNA of this country, and that translates to what we do as well. So we've been constantly trying to push the envelope on how to, in the surgical realm, for example, how to do transplantations in ways that can get patients home quicker, with less pain, robotic surgeries, surgeries with very, very small incisions, putting in kidneys with tiny little incisions. So our goals really are to be able to give the kind of care and constantly innovate. So not only are we just delivering the care, but we're actually leaders in terms of how that care is delivered.
So constant iteration for the improvement of patient outcomes, a really powerful point, and we want to hear more about that. Dr. Shiva, if I can bring you in now. With your specialist area, liver transplantation, let's hear a bit about what's happening in this area, the innovations, and what we can see going ahead.
So thank you for having me. Just to provide some historical context, we did the first liver transplant about a little over 7 years ago. And we've come a long way at CCAD since then, having done more than 100 last year. So, what sets us apart, as Usman and Waleed alluded to, is that we are part of the Cleveland Clinic Global Transplant Enterprise, which allows us to not just collaborate with colleagues in the clinical realm, but also stay ahead of the curve in terms of research and innovations in transplantation. The second thing is, what sets us apart is it takes a village to make transplantation succeed. So patients with organ failure are among the most complex and challenging patients to take care of. So we can't do it alone without support from our colleagues, and we have depth and expertise in all the areas. Now, coming back to liver transplantation, I think what we have been able to accomplish in the last 7 years, I think a lot of credit goes to the healthcare ecosystem in the UAE, with our collaborators in the Ministry of Health and Prevention, Dr. Ali and the National Transplant Committee and the Department of Health. We couldn't have done what we have done without the healthcare ecosystem that exists. Now, to exemplify that point, the UAE is among, I think, number 4 in terms of the countries that has seen the most increase in deceased organ donation rates. And that says a lot when it didn't exist 7 years ago. So in liver transplantation specifically, the Cleveland Clinic has a storied track record of taking care of patients with organ failure and liver transplantation. So as a part of the Cleveland Clinic enterprise, our goal is not just to increase the volume, take care of increasingly more complex patients, add minimally invasive components to our liver transplant program, and stay ahead of cutting-edge innovations. And I think what lies immediately ahead in the future with help from Dr. Ali and the Ministry of Health is 2 areas. One is perhaps creatively incorporating machine perfusion, where we can store, preserve organs and improve viability and lower discard rates. And second is the concept of what we call donation after cardiac death or circulatory death. So that's what lies ahead in liver transplantation.
And these are super fascinating points that you're making here. Let's explore this further with Dr. Usman. You both mentioned there that intersection of cutting-edge innovation when it comes to the specialist areas that you work in. Dr. Usman, let's expand on these points. What are we seeing, and just how unique is it to this ecosystem and around the world?
So what I do in my everyday life is take care of bad lungs, so people who cannot breathe or people whose hearts aren't working well. We're very privileged to be part of a healthcare setup where we can now take care of these really sick patients who need either a lung transplant or a heart transplant or complex surgeries, robotic surgeries for tumors of the lung or other heart issues and so on and so forth. So we have a very experienced team of thoracic surgeons, cardiac surgeons, cardiologists, and a lot of the other specialties involved in taking care of some of these really sick patients. I can tell you, without going into details, that we are doing some of the most cutting-edge procedures in the world in terms of taking care of these complex disorders. We've surpassed most hospitals in the world today in how far we've pushed the envelope, as Dr. Waleed mentioned. And one of our advantages is that we're in a very unique setup. We're not an entity that's separate from the country's vision. We are part of the country's vision. And if it's okay with you, I'll take a moment here to recognize the visionaries who are our partners in this journey. And this discussion, most of you are aware of this, and if you're not, this discussion about giving the gift of life, giving an organ to someone who will die if they don't get an organ, we are a very small part of that picture. A much bigger part of that story is a family, is a person who donated that organ. And that building that system does not just happen overnight. It takes years and years of creating a vision, creating a system, and building on it to bring it to a level where we're now offering these life-saving treatments to people from all over the world. So if it's okay with you, we have one of the visionaries in the audience, and I'd love to introduce him and have him come up and say a few words. Dr. Ali Obaidli, who's our partner.
We'd be very pleased. We'd be very pleased, Dr. Ali.
In building this program and leading the country forward. Dr. Ali, please join us.
Please come to the stage.
Well, thank you, Usman. I think...
Please take a seat.
Well, thank you very much. I think what we are talking about is more than medicine, because it's a symbol of solidarity between human beings, a sign of tolerance and coexistence, which is the foundation of this country hosting 200 nationalities together. So I think we are lucky to be existing in an environment where we have unlimited support from the leadership. The legislation gets updated in timely manner. And when you put everything together, there is no limit of how human beings can be kind to each other, even if it's something like as complex as organ donation. So just to give you an idea, I think we started 2017, so relatively later than many countries. In 2017, donation after death resulted in 11 organs being donated to save lives. Last year, we had 354 organs to save lives. So the rate of the growth was highlighted as it is very fast growing. But I think to put the perspective is that the work needed was that to bring all the medical professionals on the same platform. Because what the public wants when they talk about end-of-life care is transparency. And is the fact that hospitals, critical care, ICUs, they forget about the name of their hospital. They work as one team, because if you want to maintain trust, it could be that that family wants a second opinion from another hospital. You can't say that hospital is my competitor. No, for this program, we work as one team. And when you approach it with this kind of transparency, first of all, the family may not even be aware that their loved one is no longer in coma, unfortunately. So once they see that in full transparency, they are getting all the information, then they learn that, very rarely those who die, small fraction of them could be in a position to save lives. And surprisingly, lots of people are saying, this is how we would be a legacy. And we think about our loved one who now died. We think that he or she wanted to be that hero. So just giving the public more information, the public will surprise all of us how kind and how they want to help each other.
And I think you're absolutely right. It's a case of, you mentioned this is 2017, and it's already seen the speed and the efficiency which this has been taken up is remarkable. And I think that in itself deserves a big round of applause. Thank you, Dr. Ali, for giving us that insight. And while we have you on stage, this idea of raising awareness, it's a sensitive issue. And I know with Dr. Usman, we've been on stage. These are grave issues that we're speaking about. These are very troubling and tragic times in families. So to encourage donation can be very troubling. It's not an easy conversation. However, it's vital. You mentioned the word legacy there. Dr. Ali, while we have you on stage and you're our impromptu guest, and we're very glad to have you, what would be some of the questions that you would like to put to the surgeons? You can be my co-host. We have these frontline surgeons here, Dr. Usman, Dr. Waleed, Dr. Shiva. What would you ask them? What can we encourage them going forward, going back to their day job?
Well, my question to my dear colleagues would be that, typically we say to a patient, what did you learn from your doctor? Okay? But I think in this case, oftentimes we learn a lot from our patients, our heroes, our donor families. We learn from them. So, and the UAE wanted, the highlights to come from these successful stories. So my question do you happen to remember a story of a donor family or a recipient that their life was transformed? And can you just briefly mention some highlights? And did you learn something from the patients as much as sometimes patients learn from us?
Fantastic question. I think I'm going to be out of a job. You're going to be the next moderator. Let's give each of our surgeons a chance to give a one-line answer. I know that we are running out of time, but just one example each. Dr. Usman, we have heard from you, so I'm going to ask Dr. Shiva. Take the mic, Dr. Shiva. We want a patient experience. Give us some moving insight in terms of what you've learned from patients, how it's transformed a family's life.
So again, as Usman and Dr. Ali said, the number one challenge in organ transplantation worldwide is the gap between demand and supply. So I think high marks to Dr. Ali and his team for increased awareness in disease organ donation. We wouldn't be on the stage today if not for the simple fact that we've gone from zero to where we are today. Second point, we have not only helped patients in the UAE, but in the broader region. And Dr. Ali has led efforts to collaborate with Kuwait, but I'm proud to say we have transplanted 100 Kuwaiti nationals at CCAD and counting. Finally, that story you asked me goes back to when we started collaborating with Kuwait. We had a very critically ill expatriate patient who was in the ICU, and we reached out with an SOS to Dr. Ali and the team for organs. And what we ended up doing, as we always do, is give the organ to the most critically ill patient and most in need of the transplant. So we procured a liver from Kuwait, transplanted an expatriate in UAE who would otherwise have not made it. And it was, so again, it goes without saying that we wouldn't be here today with our donors and their families. But definitely, I think high marks goes to the ecosystem here that has propelled us towards success in the last few years.
That's a really poignant example. I'm really glad you shared it. Dr. Waleed, I'll give you a chance, and then we're going to give the final word to Dr. Usman on the examples.
It's hard to pick one person because everyone really is a hero, and
Absolutely.
everyone who donates in this time, their time of the darkest time for a family, is an act of selflessness that I think is very difficult to appreciate unless you actually are in it. And to see families who may get a phone call and they have an expatriate relative who's here on their own who has passed away, and they fly in to sign the consent papers such that their family member can donate to someone else. If you think about how powerful that is, it's hard to put that into words.
It is powerful. I'm glad that you have tried. I think you have captured the sentiment. I appreciate that. Dr. Usman, I did interrupt you, but I know you have very powerful stories, so we wanted to save the best.
Well, we're very fortunate that we draw our energy and our power from our patients, so our job is easy. There's countless stories, but the one that's very near and dear to me is the case of a young Emirati boy. Some of you might have heard about this. He is a soccer player, but during the COVID pandemic, he contracted the coronavirus infection and his lungs completely failed. He was in our ICU for about 6 months, where his lungs were not working at all, and he was supported on a bypass machine. Starting from that point, we spent a year and a half with this kid where he was connected to these huge devices and machineries to stay alive. And we're very fortunate that we were part of this journey with him, where we took him through lung transplantation, through recovery, to going home, where he now plays soccer again, and now runs an online business and is back to normal life. And if you talk to him, if you see him, you can't tell that this kid went through this ordeal. So these are just inspirations for all of us. Switching gears a little bit, I do want to highlight again what we're here to discuss, which is when I came to this country, one of the first things I learned was the importance of tolerance. And I was told that this is a priority for the country. And I think that gets highlighted very well with the services that we offer, where we're here to take care of people from all over the world. Our doors are open, and hopefully our hearts also.
Absolutely. Really powerful example there. In fact, we should invite that particular ex-patient of yours on stage. That would be fantastic. Dr. Ali, we're going to give you the final word. Our impromptu guest on stage, and very welcome VIP guest on stage. But this idea that you've been instrumental in seeing this journey from the very start, you mentioned there that strategic vision of the country, and we have the frontline surgeons working here, delivering this, the international partnerships that actually is represented here on the stage. The stage has been open for you, the country is open for our international collaboration. It's remarkable, it's unique what's happening in the UAE. Your final words on this?
Yes, indeed. I think the whole idea of having an end-stage organ failure is about how can we restore life. And the power of angle for the society is that actually this has a preventive arm. The whole theme of this 1 week in Global Week is about how do we stay healthy in the first place so that we prevent our organs from failing. But then, when your organs fail, we always talk about if you want to go to live in a city, is it safe? What is education like? But think about UAE is a country where, God forbid, if you suffer from lung transplant, you have equal chance of getting it regardless of your nationality, regardless of your religion, regardless of your social status or financial status. So the country chose to have everybody be equal in this critical disease. And if you think about it, all of us, when we hear about these stories, we are exposed to the best of humanity at the most critical time in somebody's or family's time, but still they choose to save life because they believe that this country is bringing everybody together to be in this journey together.
And that's a beautiful way to end it, the best of humanity at the most critical time. And that really is the proof, really, of humanity as well, under pressure. Thank you so much, Dr. Ali, for joining us. Dr. Shiva, Dr. Waleed, Dr. Usman, Dr. Waleed and I are going to be back on stage in just a few moments as we set the scene. But for now, to my audience, please give our wonderful panelists a big round of applause. Thank you.